Good morning, everyone, and thank you for joining the Center for Disability Empowerment's Emergency Readiness series. My name is Marley Sade, and I am your project manager. I am a wheelchair user with brown hair and brown eyes. I am wearing a green top with black leggings, and my pronouns are she and her. Today's presentation is on mental health, and we have two presenters for you. We have Kristin Jackson and Christy Karns. Good morning, guys. How are you doing today?
Good morning. Good. Thank you. Should we go ahead and introduce ourselves?
If you do not mind, yes.
Okay, I'll go first. I'm Kristin Jackson. I work at OSU in their physical medicine and rehab department. I'm a rehabilitation psychologist by training, and we'll be talking a little bit more about mental health in an emergency situation today. My pronouns are she and her. I have curly, I don't know what color my hair is, reddish brown, I don't know. And I'm wearing a black shirt today. So thank you and welcome, everyone. I'll hand it over to you, Christy.
Good morning, everyone. My name is Christy Karns. I am a psychotherapist at Southeast Healthcare, which is a community health center. I treat people who have PTSD and other mental health disorders within an integrated healthcare clinic. And it's great to talk to you all this morning. I have green, brown hair, and I'm also wearing a green dress this morning. My hair is a lot of different colors.
Welcome. Thank you for joining us, ladies. I really appreciate you being here with us today and giving us some information on mental health during and post emergencies.
Today, what you can expect is we're just going to be talking about what we know is kind of pretty normal for during and after emergency and or trauma events and the psychological impact. So in terms of traumatic events, there are different types of trauma, at least when we think about the kind of impact that it can have. So there's maybe the most commonly thought of like time limited or single events. Those are things that usually have a pretty distinct start and stop. That's a really good example is like a car accident. That's a pretty distinct event. Another type of stressor is what we think of as like sequential stressors. That is where you have different but repeated exposure to traumatic events. And essentially, the reason that's important to know is those different traumas can add up over time. A really good example of that is actually first responders or police or people that are repeatedly being exposed to things. And then I think important for this talk is the discussion of complex or long-lasting exposures. Some examples can, of course, be war combat, childhood trauma, but also in this talk today, things like a really good example, I think, is like when Katrina happened. So people were stuck in this area for months, maybe even longer than that. They didn't have basic necessities. They were seeing really horrible things. So that is an example of like a complex, long-lasting trauma. In terms of trauma, why is it such a big deal? So essentially, the reason that we have such a tough time with trauma is because it really shakes the way that we think the world should work or how we think our life should work. So we struggle with when things like this happen, this idea about this shouldn't have happened, this isn't fair, this isn't right. And for most people, even when we know logically that this isn't true, we still hold this really deeply rooted assumption that the world is generally safe, predictable, and that bad things don't happen to good people. And so essentially, when traumatic events happen, it's almost like there's a picture here of a robot that says does not compute. And I think for many people in traumatic situations, it essentially does not compute. It doesn't mesh with their perceptions or assumptions about the way the world should work. So when that can happen, it's such a conflict with what we're expecting that it causes some pretty intense emotional reactions, including, of course, fear, uncertainty, helplessness. feeling like it's not real, like it's surreal, all those kinds of things. And then one thing I want people to be, this is like a takeaway message, like for most people, when we ask you, hey, what would you do in this situation? You give us this beautiful answer of like this beautiful plan that you would execute. And most often people significantly underestimate the impact of emergency kind of reactions and the impact of these intense emotions. So they typically think that their thoughts and actions and ability to problem solve in a crisis are going to be the same as when in their natural kind of everyday life. And so they expect this really clear A to B straight linear process. And usually the reality is much more convoluted, confused, and uncertain than that. So I think one takeaway message is that we really want to give you some specific things that you can practice beforehand so it's not as confusing and chaotic. And I also want to say, please at any time, let us know if you have questions or comments. So this is actually something that people probably heard of before, and maybe even during previous talks, this idea of fight or flight. That's what we most commonly hear. It's actually technically fight, flight, flight, or freeze. So there's actually 3 reactions that your body is naturally kind of hardwired for. So the purpose of fight, flight, or freeze is essentially to keep you alive. It is a survival mechanism. Essentially, this mechanism is automatic. Like you don't have to consciously choose to do this, and actually you can't. It just happens. And these reactions essentially were designed to prepare the body. So it engages in this whole series of physiological and hormonal changes, all designed to get you ready to do one thing, which is survive. So fight or flight is considered an active defense response. So your heart rate increases, oxygen flow to the major muscles increases, your pain receptors actually decrease. So your response to pain is muted during emergency events, and your hearing can sharpen. There's other changes too, but those are the kind of core ones. So all these designed are supposed to help you kind of react quickly and appropriately in emergency situations. And they're essentially trying to get to the point where they don't involve your higher kind of problem solving processes because they want it to be fast. And those higher processes take time. So they want you to automatically be able to react. The freezing is essentially what we consider fight or flight on hold. So it's essentially a reactive immobility or an intended immobility that involves similar physical changes, but instead of doing something more active, you are completely still, but you're ready to make your next move. So I think one thing I want people to know is most often you don't choose which of these processes you go into. It's very instinctual. It's very kind of like reptilian, part of our reptilian brain. It's like the most primitive, hardwired part of us.
Oh, we do have a raised hand.
Yes.
Anna would like to voice her question.
Oh, thanks. That's way easier than typing. My question was just, I think there are certain people that maybe lean toward one of these versus the other. Is that something that can be changed through kind of conditioning? Like if you're raised in a family where everybody like has a fight response to things, like can you become that, or is it really just like whatever's in your brain is in your brain and you're kind of don't have an option?
So in terms of general behavior, yes, your behavior can very much be impacted. And over time, if you are in an environment throughout your developmental periods, it can impact your nervous system's wiring, so to speak. So if you are in a potential environment that has a lot of conflict or something like that, then it can definitely impact your kind of nervous system's reactions in a general sense. That still may mean that in an acute crisis, You don't have, like, again, conscious control, but
Hello.
it's very much that previous
Oh, shoot.
experiences can influence your kind of body's response. Christy, do you want to add anything?
Yeah, I would also say that the type of threat can also impact how we respond as well. Some folks who tend to notice that they fight in certain circumstances, a crisis could come up where they're totally frozen. So there's definitely the type of threat can impact our response to you.
And I think, like, our body is making these quick decisions, but it does take into account, like Christy was saying, the type of threat. So a really good example that I often talk about with my folks is, let's say back in our caveman days, like, we were having to fight off, like, predators. There may be some predators that it makes sense for us to run from, and our knowledge of those predators will be taken into account. But let's say there's a tiger and they're attracted to movement. So our body may, in that situation, know that the best survival instinct is to freeze. So I think previous experience, some knowledge does get disseminated. It's just that you're not consciously thinking through that. It's happening very quickly.
Pre-injury spinal cord injury, guys, this is Marley speaking, by the way. Whenever someone used to surprise me or come up behind me, instinctively, I start hitting. It was just like an automatic response. I couldn't help it. And sometimes it got me in trouble because my friends are like, why would you do that? And I was like, I didn't know it was you. But then after my car accident and my injury, when people would start grabbing me from behind, I started to, like, hide and freeze almost. Like, I would, like, cower in on myself, put my hands and head down and say, no, please don't touch me. And it really, really bothered me when that started happening, because that wasn't something I would respond in, or how I would respond, but it changed over time.
Yeah, so I think one thing, maybe a good takeaway message, is that our nervous system is an amazing thing. It can learn.
Mhm.
It can learn. And sometimes that's to our benefit. We're like, oh, great, I'm learning good things. And then sometimes we're like, oh, I don't want to learn this, but
Yeah.
it happens anyways, right?
Yeah.
A really good example of that is, as anybody had food poisoning with, like, a specific food? I have.
Yeah.
I still to this day cannot eat ramen. Can't, just can't, because my nervous system, even, like, to the point it had such a strong association of, this thing is going to kill you, that I have not been able to eat it since. So I think that's an interesting thing. Sometimes our body learns without us even intending it to learn. Okay.
Yeah, absolutely.
Unless anybody has other questions, I'm going to move on. Oh, okay. So I think this is where Christy's going to take over. She's going to talk a little bit about when the trauma is potentially over, but maybe you're still dealing with effects, because, as we know, even though maybe the situation over, that doesn't mean it's over for the individual.
Yeah, absolutely. So before we move on to this next session, does anybody else have any questions or comments about active trauma responses?
Nothing coming up in the chat.
Okay.
We'll be talking more about how to, like, what to do to get better at both active and then after. So that will be coming, just if anybody has questions about, like, how do we handle that.
Yeah, and I'm glad that we started talking about the nervous system, because that very much plays a major role in after responses as well. Our brain and our body are connected through our nervous system, and there's a lot of information that gets stuck there, if you will, after a trauma has occurred. Much like the example that Kristin said, our body has physical reactions to trauma even after it's over, when our brain is reminded of that trauma. So, some common, side effects that happen after trauma are listed in the slide, as well as I think just what I really want to get across through this part of the presentation is that even though it's in the past, it's not over. That there has been a permanent change to our brain and our body because of trauma. So sometimes I'll hear people, kind of beating themselves up over, it happened so long ago. Why is this still impacting me? It's because we're different now, physically, mentally, spiritually, we're different. And so that's something that can't be ignored.
Yeah, I think, Christy, I just want to quickly add, I think in our culture and the way that we think about like mental health, unfortunately, it's done us a huge disservice in that people think that the impact of it isn't real. Um, and if anything, you come away with this is that it's just as real as any other condition, as much as a broken leg, diabetes, any of those things. It has basic kind of physiological underpinnings. Like, I always ask people, like, what do you think a thought is? And most people have never actually considered what a thought is. Essentially, it's various neurons connecting in our brain, which then leads to different physiological responses throughout your whole body. So these things aren't magically impacting you, they're physically ingrained into what's happening in your life.
Yeah, absolutely. When I'm working with people, I refer to it as wounds, that there's been injury there that is occurred. Even if we're not able to, if the science isn't there to physically see the wounds, that they are there and they do live inside of our body. That's something that we have to care for. If we want wounds to heal, we have to care for them. Those wounds may take the shape of fatigue, sleep disturbances, other signs that trauma is still living inside of our body. And I think even the word trigger has unfortunately kind of gotten a bad rap in culture currently. But it's a real thing that happens. If our body and our brain is reminded of the trauma, it brings up that experience, those emotions that are still unprocessed in our body, and we're going to feel that. So it's just not something that, we can push to the side or it's over, so we're done with it. It's something that we're still very much have a relationship with. Trauma is a huge range of experiences, much like Kristin talked about at the beginning. Oftentimes we think of trauma as war, car accidents. Of course, in terms of this discussion, we're also talking about, natural disasters and things like that. But anytime that our natural ability to cope is overwhelmed, it starts that same biological response that's trauma, and that's going to inform how we cope with future trauma as well. So for some people, they can experience trauma and be able to cope with it and find natural resources, community, things like that. But for some people, they have long lasting impact from it.
Yeah, 1 in 5. Like, that's
Yeah,
pretty.
absolutely.
1 in 5. So I do want to like normalize this somewhat in that, like, 1 in 5 is quite a few people in terms of if you are in an emergency experience, it's not going to be super bizarre or unusual if you do have mental health symptoms.
Yeah, absolutely. That's a normal response for experiencing a trauma. Again, going back to that idea of trauma as an injury. So, of course, if it's normal to have a wound after being injured. So, not everybody who experiences trauma develops PTSD, but it is also a very common reaction to trauma as well. PTSD, can look very different depending on the person and complexity of trauma. So, complex PTSD occurs when somebody has repeated traumatic events throughout their life. And there's a lot of elements that can add complexity to trauma. So I know that when we were talking about trauma yesterday, we were talking about like Katrina, that was a major natural disaster where that initial trauma was, the natural disaster element, but then the displacement, the having to, see such visually and be immersed in such disturbing, seeing people who have passed away, things like that adds complexity. And so when there's complexity to trauma, it's more likely to present with, other symptoms as well. So the next thing that I wanted to talk about as well is it goes back to, again, when we talk about how we have this expectation of how we'll react in a crisis, what we'll be able to do. We kind of picture ourselves being able to, be the hero, save our loved ones, things like that. And it's just not how a crisis goes. And because of that, oftentimes there can be survivor's guilt. So when people are able to survive a crisis when others don't, thinking of mass shooting events, things like that, those can often trigger feelings of guilt if we're able to make it away when we see other people who didn't.
Yeah. And I think we want people to understand, like, today we're going to be talking about like what is within your control to manage, but we are very much wanting people to understand that there's a limitation, there's a ceiling effect. You have limited choices during an emergency in terms of how you react. Our reactions are often a complex combination of neurobiological previous experience learned behaviors. So it's not like you're going to have this huge range of like all these options. It's going to be quick. You're going to be making quick decisions. They're going to be based on the number one goal of survival.
Yeah, absolutely. So we're also going to have complex feelings about it afterward if we survive and others don't. That's not going to be an easy, okay, we've accomplished our goal of surviving and, we go on and live the rest of our lives. It's going to be a lot more challenging than that. And that's okay. That's a reasonable response as well.
So yeah, we're going to be jointly talking back and forth, both of us, about like essentially like what we said, what can I do to either prepare or help me during an emergency event? So we're going to be discussing several coping methods that you can use during a crisis. We're also going to discuss ways that it can help you after a crisis. So like Christy said, just because the crisis is done doesn't mean the emotional impact of that just disappears. Like we said, there can be a number of emotional reactions that could lead to the point of like a specific diagnosis like PTSD, or it could just be more of a general struggling with like, why did I survive and others not? And that can sometimes really bother people. So we'll be discussing various options for during and after. So in terms of coping, I want people to think about coping from a variety of perspectives. There's you as the individual, then there's your wider circle is like your family, and then there's in some instances, especially in terms of natural disasters or other types of disasters, or even right now, the virus going on, there's the community coping response, right? So many situations actually do overwhelm an individual or family's resources. And it is not uncommon and it's very appropriate to reach out to your lifelines, right? The picture here is essentially of trapeze artists like reaching out to the other person to grab them. And that is what I often think about. Like, you need to grab onto your lifelines and think about what are your resources in terms of community resources, professional resources, or additional services. So I think during a crisis, a lot of times what I tell people is we need to start with the basics. Like, the question to ask yourself is, do I or can I change the situation that I'm in? It makes sense if you have the ability to change the situation that you're in. It makes sense to go into like a problem focused coping response, which is essentially focusing on resolving the source of the stress. So a good example is, hey, I'm thirsty. It's a crisis. We don't have any water. If I can get water, okay, that resolves a current need, at least in that situation, and I can move on to the next thing. Sometimes that's not possible, though. Sometimes you're stuck in a situation where you can't magically fix it. You can't magically make the source of whatever the stressor is go away. Especially in emergency situations, there's a lot of things that are outside of our control. I mean, we can't control other people, right? So if there's like a active shooter association, you can't make that person just suddenly stop, right? So you in that moment might have to instead focus on, okay, I'm accepting I can't fix these things, so I need to figure out what I can do. And that's either try and resolve something in the situation or try and resolve my emotional reaction so that I can cope in the current stressful situation that I'm in. So, what is the benefit of using coping skills during a crisis? Is it to avoid panic? Is it not possible to cope during a crisis? A crisis is a great time to learn something new. Great job. You're already on point. Yeah. So most people recognize it's to avoid panic. So when possible, of course, nothing's perfect. We want to try and reduce and control panic, mostly because panic tends to interfere with our higher thinking processes and executive functioning. Executive functioning is where we essentially evaluate, manage. It's where we have impulse and inhibition control. So not acting on every single thought that we have. Like, it's very important to be able to calm ourselves down enough where we can think through what are our options if we can. Sometimes that's not possible, and then you have to just instinctually do the best you can. But if possible, we want you to reduce panic, especially in longer term emergencies. That's going to be really, really important. So, panic, I don't know if anybody's had panic attacks, but they're pretty awful. They're pretty intense. So, they're usually rapid, shallow breathing, racing heart rate. Your hands and feet can get cold because, again, all the blood is shunting to your major muscles and organs. You can feel dread and overwhelmed. You can be sweating, clammy. So, it's pretty intense physiological reaction. One thing I think is a takeaway message is we want you to practice these methods before you need them, before you get into a crisis. Mostly, again, because you're not going to be thinking really well. You're not going to be in a crisis, like an active shooter situation, being like, what did Christy and Kristin talked about? Oh, yes, breathing. I'm going to practice breathing now. I've never done it before, but I'm going to learn it now. So we really recommend incorporating these methods into your kind of day-to-day routine. And the office space picture here is like, yeah, I'm going to have to ask you not to panic. That'll be great. Thanks. I'm a big office space fan. Christy, do you want to take over here?
Yeah, absolutely. And I was also going to add that, when we are able to manage panicking, we're also just able to kind of give ourselves more choices, in a crisis as well. If it's important, as we've talked about, for that survival instinct to kick in, but if we're completely overwhelmed by it, then we're not able to think enough to be able to aid ourselves in surviving. But as we've mentioned before, our brain and our body connected through our nervous system, and one of the fastest and easiest ways to slow our nervous system down and give us more of a window when it comes to that survival response is breathing. Especially a long exhale really helps with slowing our nervous system and being able to kind of, again, slow that survival response enough that we're able to think more clearly. Again, it's quick and easy and accessible. I understand, when it comes to some chronic illnesses, we may not be able to take, the biggest, deepest breath before we start coughing. And that's another reason to practice beforehand too, because what's a deep breath is going to be different for everybody as well. So we want to really get to know what a calming breath is for you, because it's a very individual thing. And there's just kind of different methods for it as well. There's the circular breathing, there's the diaphragm breathing where we're breathing with our belly. So there's different exercises out there. YouTube's a great resource. I know I'm more of a visual learner, so I like to see these different breathing exercises demonstrated.
Yeah, and I'm going to echo what Christy said. It's really about finding an individual fit, because your lungs may not feel comfortable following whatever counting method or whatever method you may be trying. So it's really about tailoring it to you and learning your body's relaxation response. So I think in
Absolutely.
this situation, it's like practice.
Because I know for myself, because there's one method which works great for some people where it's, inhale for 3 seconds, hold for 3 seconds, or exhale for 4, whatever the numbers are. But I know I get really anxious if I hold my breath. So it has the opposite impact on me. So I skip the hold. So again, just kind of, even if you're following along with different exercises, don't do anything that's counter to what your body's telling you if it's relaxing or not.
Mhm. And I think you can look for cues too.
Mhm.
Usually, like if you're getting into that relaxed state, you're inhaling, your chest is kind of tightening. As you exhale, if you don't kind of notice that relaxation effect, your shoulders dropping, then maybe you need to modify things a little bit. So mindfulness. I'm sure everybody's been heard of this. It's all the rage right now. But essentially, mindfulness is just a specific way of like focusing your thinking. So essentially, it's asking you to focus on the current moment and kind of objective observations rather than maybe getting really stuck in kind of catastrophizing, which is essentially a term for the way that sometimes our thoughts can come up with all the horrible things or all the ways that things could be worse, even though they're not even happening yet. So sometimes to avoid that panicked or anxious thinking, if we can focus on physical sensations around us, that can really help focus your mind on the here and now and immediately in your environment. The other thing that I think we don't give enough credit to is how we talk to ourselves or even how we label situations can have a big impact in our reaction. So, if we're able to label a crisis as a challenge versus like a catastrophe or a stressor, then that can impact our kind of perception of what we're able to do in that situation. I think because we often think about like meeting a challenge or attacking a challenge versus being helpless. Um, so that is important to kind of think about too, kind of reminding you your self-talk to focus on your capabilities and getting through that rather than feeling helpless and out of control.
And I
Anything
think
you
too,
want
a
to add?
benefit of just kind of being present in the moment is, even if being in the present is really terrible, and I've talked to people a lot with this with the COVID crisis, even though here in the present, there's some major challenges and it's very difficult, all things move, time experiences are transient. So if we can just kind of acknowledge what our emotions, thoughts, experiences here are in the present, we're actually less fused with them and they're more welcome to kind of go on their way, than if we begin like catastrophizing about, this is going to be, so much longer, and, really focusing on those negative thoughts instead of just kind of, we benefit more from just being with what we're experiencing in the present.
That's a good addition, Christy. I think a thing that I forgot about mindfulness is that mindfulness is all about observation and non judgmental acceptance.
Mhm.
So it's essentially saying, this is what I'm thinking, this is what I'm feeling, but that's okay. And I don't have to fix it or react to it. I can just like let it be. Like Christy was saying, it comes and it goes, which I think for most people is hard for us. But again, the more we practice that way of thinking, the better we get at it. Okay, you want to talk about after a crisis, Christy?
Yeah, absolutely. So, much like with the mindfulness and self talk and things like that, those are all skills that can carry forward after a crisis as well. Of course, we're just, the lens has changed. Again, we still benefit from activities that soothe our nervous system, because there's going to be times that that fight or flight response is triggered again. Anytime that, we have a smell, taste, any sort of sense that reminds us of that trauma, it's likely that that's going to come up on our nervous system again. And our brain and our body's going to think that we're in that situation. So we need to be able to use some of these skills to remind ourselves that we're just in the present, that that threat is no longer there, and ground ourselves there. So I included an exercise that, again, pretty easy and accessible. Again, depending on, if you have vision, what senses are available to you. It can be adapted to whatever senses you do have access to. But 5 things you can see if you have vision, 4 things you can feel, 3 things you can hear, again, if you have hearing, 2 things you can smell, and 1 thing you can taste. Taste isn't always available, if we're on a bus or something like that, I don't recommend, tasting anything there. But whatever senses we do have access to in that moment, beginning to sense into those in order to feel grounded in the moment. So something I was also going to do today is lead us through a brief body scan, because sometimes when we're feeling very triggered by, something that's come up, again, we're just not here in the present the way that we'd like to be. We're kind of very fixed on, our past trauma, or, we may be catastrophizing about, what may happen in the future. So we want to learn a skill that helps us to just notice what's coming up here in the present and kind of allow that to move on its way. So with this exercise, you can choose to have your eyes opened or closed, whichever you prefer. Some people feel like they can't focus if their eyes are open, and some people don't feel safe if their eyes are closed. So if you'd like to just gently gaze at the floor, if that's your preference. So whatever is a deep breath for you, we want to start out with just a breath in through our nose and out through our mouth. And beginning at the top of our head, we just want to begin to gently notice what we may be experiencing on our thought channel, our emotional channel, and our physical channel here in this moment. Almost if we're guiding a magnifying glass down our body, and just being a kind observer of whatever is on the opposite end of that lens. So we can begin to guide our attention down through our neck and shoulders. Just noticing if there's any tightness, looseness, or any physical sensations we can notice in this moment. Continuing on through our arms and chest. And if we can, pausing for a moment, just to notice what our breath is like in this moment. If it's fast or slow, or deep or shallow. And if we can, just really noticing any rise and fall in our chest or stomach as we breathe in this moment. Before we continue on through to wherever we have sensation in the rest of our body. If our sensation ends at our torso, we can begin to move our noticing back up through our body. Again, just pausing for a moment to notice what our breath is like. If it's fast or slow, or deep or shallow. And then moving back up through our shoulders and neck till we're once again at the top of our head. And we'll end with one more deep breath. Any feedback on that exercise? Everybody a little bit more relaxed?
So I think that's a nice example of how I think sometimes people think these things might not have a big impact, especially in a crisis, but if they can just slow your body down a little bit, I think they can be really helpful. So just something to kind of maybe practice as well. Any other thoughts or feedback?
And I was going to add as well is I think sometimes when we think about meditation or mindfulness, we picture this whole like 30-minute candles bathtub routine. Yeah. When in reality, that exercise was like a minute. So we never want to tell ourselves that we don't have time to check in with ourselves, because there's always time. That's something that we really benefit from prioritizing.
Yeah. And I think for people just to know and normalize, it's something that I think we continually have to remind ourselves to prioritize, because we do sometimes get focused on just being busy, busy, busy and be like, oh, I don't have time for that, I'm so stressed. When I think if that's something that you're saying to yourself, that's probably when exactly you need to focus on that. That might actually be an indicator to yourself that that's when you need to check in with yourself.
Absolutely.
Okay, so one thing I think we both, Christy and I, want to get across, and I know we're biased, we're in the mental health field, but I think I want people to know, like, this is a quote from Charlie Brown, who's iconic, right? Asking for help isn't weak, it's a great example of how to take care of yourself. So I think, just like anybody that's been on an airplane, what's the spiel you get at the beginning, right? In an event, an emergency, these oxygen masks will come down. Put your own on first before you assist anybody else, right? And so what I think I want you to remember is, if you don't take care of yourself, you're going to be useless to anybody else. You're not going to be helpful to other people that you care about and want to assist. So you have to take care of yourself. That's so, so, so important.
As we've mentioned before, trauma impacts everybody very differently. There's so many factors that go into how we may be impacted by trauma, including if we've experienced trauma in the past. So I wanted to include some just kind of general indicators that we may benefit from exploring our trauma with somebody who has experience, and kind of guiding people towards, addressing and healing these wounds. So if we really find ourselves just kind of struggling in functioning with others, with moving forward, with being present in our life. Um, and when I say moving forward, I don't mean, completely forgetting about it. That's over, done with, never. Really, it's about integrating that trauma into our life, and adjusting and adapting to what we face now. And for a lot of people who have experienced trauma, it's more than a one-person job to do that. That we do benefit from somebody helping us to, work with some of these triggers, the disturbing memories, the difficulty that can come in relationships, because ultimately we've changed because of this trauma, but the people in our life who weren't impacted directly, or weren't as impacted by the trauma, their lives may look different as well, or the same, and that can cause some issues in relationships. So those are just some general things to keep in mind when we're considering, do we need some extra help after a trauma?
Well, on your last point, Christy, like, if you find yourself making adjustments and avoiding things because they cause distress or symptoms, it can be really subtle at first, but over time, all of a sudden you can look back and realize, oh, you're not doing things that you used to do because you're trying to avoid distress. That's a really good indicator that, gosh, maybe I don't want to keep avoiding those things. Maybe I want to be able to go to the grocery store and not have a panic attack, or whatever it is that you've been avoiding.
Yeah,
And so somebody
absolutely.
like myself can help with that.
Yeah, and you're right. It does often start out small, where, I don't really go to the mall anymore because I don't want to be around all those people. But then you're right. Then we're struggling with the grocery store, or we're struggling with going to family events. It can often get away from us before we even really understand that trauma is what's impacting or making us want to avoid these situations. So just some kind of general knowledge, and these are great for, continued personal research if these are things that really interest you. And, I know I'm trained in EMDR. I know Kristin's mentioned that she does the prolonged exposure therapy. And so, if you do have any individual questions, we can maybe get into that briefly. But, ultimately what's important when it comes to trauma therapy is, again, finding somebody who we trust, so that way we can begin to work on integrating the trauma into our life. There's no way to go back and be the person that we were before the trauma. That person doesn't exist anymore. We're always here in the present. So we want to work on, being who we are now?
While people are voting, I'm just going to quickly say, again, this matter of fit, finding somebody that you can talk with is so important. I think sometimes we think, oh, just going to any professional will work, but this is actually pretty vulnerable work you're doing. So you have to trust who you're working with. Oh God, our participants are just on point. Yes,
Yeah.
you totally got it right. So the goal of therapy is not to make you who you were before, not to make you happy, because that's not realistic. The goal is to help you manage symptoms, and they can crop up even though you got to a place where you're good with them. They can crop up later. So we just want you to know how to handle that. And that's essentially what we're teaching you when you go to trauma therapy. We're teaching you how do you manage these symptoms. Eventually, I always tell my patients, I want to teach you everything so that you know what to do and you don't need me anymore. I'm like teaching myself out of a job. But that's really the goal of trauma intervention. The goal isn't to make you happy. It's like Christy said, not to make you forget. It's not to make you who you used to be. It's really to help you move forward with who you are now. So I think overall our goal is to help you kind of figure out in what ways can you prepare for the mental and emotional impact. And there are some definite ways that you can do that. So prepare, but also if this were to happen, if you were to have an emergency event or a tornado or whatever it is, it's also okay not to be okay. Just don't stay there. That's my kind of thing. Like, I want you to know that there's a number of ways to help you through that. You don't have to go in at that alone. There's options and resources, so you don't have to stay in that place.
I think you guys have covered everything great because we don't have any questions.
Okay. I normally have some questions too at the end, but you guys did such a great job. You answered all my questions.
Great. Okay. Good.
In that case, if no one has any other questions, I would like to say thank you to Christy and Kristin for joining us today. I want to also make a note that Christy and Kristin are not here so that you have a mental health specialist. If you have questions or concerns regarding this topic, yes, they're more than happy to answer and follow up with you. But if you are looking for a mental health specialist, we would ask that you follow up with your providers, Medicaid, Medicare, or your insurance company first, and start the process there.
Yeah. And if you do, I think one thing I want to recommend, if you are looking for a mental health provider, I think fit, also insurance coverage, right? We got to deal with the practicalities of life. But also make sure that they know like specific ways to help you for whatever specific concern you're having.
But I believe what Kristin was saying was that we want to make sure that we're finding somebody who has a specialty that can handle what we've experienced as well, and that they have additional training in trauma therapy, or that we feel like they can best meet our needs. And unfortunately, that may take some looking around, but that's okay. A therapeutic relationship is a relationship. So we benefit from finding somebody who we feel like is going to help us the best.
Mm-hmm.
Did you take over for me, Christy? Because I got kicked off.
I finished what I believed your thought was.
Thank you so much. Okay. Thank you, everybody. Thank you so much for participating. Hope it was useful.
It was. Thank you so much, Kristin and Christy. I also want to say thank you to Jamie for her tech support. I would like to say thank you to PRI Captioning for their wonderful support. And I think Kristin froze again, but at least she froze with a happy smile on her face. I do want to remind everyone that we have another presentation scheduled for Friday. And this one is going to be a big one. We have Adam Ingram from Franklin County's Emergency Management and Homeland Security, and he will actually be joining us to help create our plan. This is when we'll sit down and really create as much of our plan as we can. on Friday. So look for the email that you will receive requesting certain details for Friday. But other than that, I wish everybody a happy Monday. Thank you
Thank
so
you.
much for
Bye-bye.
being here.
Bye.
Bye.